So you answered a lot of questions for us, and we really appreciate that. But I do think there are a couple of takeaways. So getting involved in this kind of forum, working with some of the consumer groups who have a real interest in this, and then the other one that I'd like to, we can talk about it afterwards, would be really engaging the states, because a lot of the lack of participation now begins with a set of state regulations that says this cannot happen. And I think what we have to do is to sort of open up that door and begin to describe a set of exchanges of information that are feasible but still respect privacy and other kinds of concerns.
Don't you think ultimately we need federal standards and not 50 state standards about the exchange of mental health data?
One step at a time.
One step at a time.
I think with that, we really are running out of time. I want to thank all of the panelists today. You really did a terrific job.
That'll conclude today's stakeholder forum. Dr. Harris, thank you so much for putting together such a stimulating panel. I have a long list of questions that I'm going to corner several of you later to continue this conversation. I wish we had another hour to spend on this, because I think that we were just getting to some of the richest themes in the entire conversation, and it gave me a great deal of food for thought for upcoming panels. There's just so much more to this conversation. Thank you very much for your contributions today, and we very much appreciate your time. We want to close, but I want to let everyone know that today, during the executive session of the board this morning, we heard reports from our finance committee and of our board work groups, and talked with the staff about the NeHC's various activities in support of the nationwide health information network. In about a half an hour, our board will go back into executive session for a discussion with the National Coordinator for Health IT, Dr. David Blumenthal. I also want to remind you about NeHC's newest stakeholder education program, the NHIN University. The inaugural semester of NHIN University is a series of free webinars intended to provide stakeholders with foundational knowledge about what the NHIN is, how it works, and the vital trust fabric that underpins the safe and secure exchange of health information over the internet. The next NHIN University class, NHIN 103, ONC Initiatives for Health Information Exchange and Their Continuing Evolution, will be held this Monday, April 19th, from 1 to 2 p.m. Eastern Time. The curriculum and faculty for this class are stellar, so you won't want to miss it. To register for NHIN University, go to the NeHC website at www.nationalehealth.org/NHIN-U. You can also find the recordings of the past classes there if there were others that you missed that went on previously. And last but not least, the National eHealth Collaborative Stakeholder Forum Board of Directors meeting will be here again in Washington, D.C. on May 25th. As soon as we have additional details, we'll pass that along to you. Again, I just want to offer another thanks to this particular panel. I think you just did a terrific job. You left me with so much to think about, both at this national level and for those things that I run back in Rhode Island. And I'd like to see if there are any other comments or questions from the board at this moment. If not, we'll declare the meeting adjourned. Thank you very much.